In our rounds discussion this morning, we talked about a nurse at the hospital that was injured when a patient lost consciousness and fell, and the nurse caught the patient, helped the patient down to the ground, but in the process injured her back. We had a conversation about this particular case and how to manage it, but also some of the issues that we face when it comes to work-related injuries and accidents and the system for that. And so I just wanted to talk a little bit about what we discussed and some of my own reading and research on that topic that may be relevant to each of you. In the state of Utah, there are 1.6 million workers or thereabouts, depending on the year you're looking at and the credibility of the data. But when I was reading about it, that was the rate. And there's a small percentage of workers each year that file a workers' compensation claim, which is probably in the neighborhood of 45 to 50,000 claims per year. The state of Utah has published that there are $32 billion worth of fraud in this arena. Most of it is done by the employer, where they're underreporting payroll and they're not paying the amount of money that they're supposed to pay for the workers' compensation contribution, which is about 73 cents per $100 of payroll funds. About 9 billion of it, though, are basically faulty claims, patients that say they got injured at work when they really didn't, and a variety of other scenarios. So that's one aspect of this, is we're dealing with a fair amount of fraud. Another aspect is most of the injuries are tendon and ligament injuries, sprains and strains. We know that those injuries don't heal particularly well. They heal best when activity and the proper amount of activity and nutrition are implemented early in the process, and sometimes that doesn't always happen in these situations. And then we don't have great objective measures in the current system to identify these injuries and say, this is the injury, this is exactly what we're seeing, and this is the appropriate treatment. Our treatments aren't great either. So it becomes the healthcare worker's job, in part, to identify causality. Was this injury related, or the symptoms that the patient is having related to the work-related injury? And almost everybody that comes in to see us has some kind of pre-existing problem. Dr. Leininger was in the rounds this morning, and he gave a great analogy. It's kind of like playing a game of Jenga. As we get older, we're taking one block of wood out, and then we're taking another block of wood out, and we're taking another. And then finally you take one that topples things. And was it that last block that you took out that caused the injury? Well, oftentimes a patient that, in this particular case, that caught the nurse that caught the patient falling, it may have been a little bit of arthritis in her lower back that is now become injured or become painful due to that. And so identifying causality becomes a challenge. Take-home messages from today's rounds. We need to be in partnership with everybody at the table, which included today the provider that was managing the case, Dr. Leininger, the nurse case manager representing the workman's compensation arena, and they do a fabulous job. And then physical therapy and chiropractic and pain management and surgery and others to really align all of the variables so that we can focus on helping the patient get better. Sometimes these situations can become a bit adversarial, people taking sides, defending certain positions, not wanting to pay claims, and again, there's some fraudulent behavior going on, so we have to have some of that. But the message would be, if you're injured in an accident, we want to get you to the proper people early on to help you stay moving and hopefully navigate this particular situation so that you can return to work and get feeling better and address any lingering and long-term issues that may be the results of the work-related injury.